For the next 2 months, the Field Medical Hospital will be located at the National Stadium to accommodate training for various agencies and approaching world-class events this year. Medical Liaison Officer Major David Clark gives us some insight.
We will be here at the National Stadium for a while, as we have a number of training courses over the next couple months, which include a training course for the Caribbean Public Health Agency. We will also be involved with the Trade Winds exercise, and also as the CARFA's response mechanism, where a field hospital is required if anything happens during the T20 Cricket World Cup. Certainly, one of the other things we are set up is to make sure that if we have to deploy, we actually know all the systems and the equipment that we have to take, and also the packing list of things that we need to take. So at present, we're classified as what we would know in Barbados as a polyclinic, our outpatients clinic, and our type 2 classification would be basically the equivalent of a general hospital offering surgical services. We are set up at present as a type 2 because we have our mentor, Luis de la Fuente, from the Pan American Health Organization based in Washington, and he's actually presently visiting with us, and we have set up the hospital facility so that he can look at our systems and actually go through.
And the PAHO representative has been speaking of the importance of the Level 2 classification.
We are very thankful for this support that BDF is developing, but also joining this effort to achieve the classification of EMT Type 2. Will be a turning point in the Caribbean. Science would be the first emergency medical team with surgical and inpatient capacity to be classified in the Caribbean. What in next hurricane season and any future emergency could happen, the region could have available the capacity to deploy a mobile hospital providing this surgical care.
But even as officials work to reach new heights, they need more volunteers.
At present, we have approximately 189, and recently we have brought on board about 45 persons to join the FMT. So as many as we can get. We are not sticking to any particular number. If we can get, persons coming in, let's say 5 lab techs, 6 doctors, we will take them all, because we're not sticking to any particular number. Because we need to build up the FMT as relates for our preparation for our verification to a type 2 medical hospital, field medical hospital.
The Field Medical Hospital was first accredited in 2019. Reanne Phillips, CBC News.